meters requires that patients first prick their fingers, and that's hurtful for many patients. They requires the patients to carry that technology in their pockets or purse every day, and often patients don't want to do that. They would rather leave those at home, and that limits them for checking their sugars as frequent as they should. The meter only gives me a shot of the blood sugar. It doesn't give me the direction what the sugar were before. It doesn't give me the direction of the sugar is going now. While new technology like CGMs, they give you all those information. Meter also doesn't give you alerts and doesn't alert when your sugars are low. There's only one in the market right now. It's called the Freestyle Libre. It's a device that looks like a disc. It's approved to put in the back of your arm. And you don't have continuous glucose monitoring, but when you actually use the reader device, you just flash. In 1 second, you get a reading of your meter, what your sugar is. It also shows what direction your sugar is going, and shows data for the last 6 to 8 hours. So flash glucose monitor, it's cheaper. And it's part of that because you don't really need a transmitter to transmit information in real time the entire time. And so it's able to majorly replace meters, and that's what we're seeing. The flash glucose monitor is replacing the meter technology across the board. One of the limitations of the flash glucose monitoring is that currently it doesn't give you alerts. And so when you have a continuous glucose monitor, if your sugars are low, it alerts the patient that your sugars are low. If your sugars are high, alerts that your sugars are high. And it gives you the data in real time. With the flash glucose monitor, you have to scan to obtain the data. So I see more advantage than disadvantage. The disadvantages is that the elderly sometimes have difficulty to learn new technologies. As this technology becomes simpler, I think will be more adoption, but there's more advantages. I think main advantage is you're able to alert the elderly that their sugars are low, alert the providers that the elderly is having low blood sugars, and therefore you can make adjustment to the glucose lowering regimens that will prevent the elderly to get low. Today, we've seen an initiation of usage of telemedicine to monitor patients with care of diabetes. We will see is a populational initiatives that will transition patients from the clinic to the outpatient setting, and most of those patients will be remotely. So instead of seeing the patient several times a year, you'll be able to see this patient mostly, like say, twice a year, and have more frequent data on their blood sugars, and you end up seeing the patients that has more need to be seeing a provider than those patients who are doing fine. And I see that use of technology allowing for that.